Hi, and welcome to our Acceleroot first live event. We are so happy to see you all here. Let me introduce myself. I'm Jill. I'm a nurse, and I've been working as a cosmetic nurse for the last 7 years, and I'm the founder of Acceleroot. So this event, we will be running in English because we do have some participants that is from different countries. So I hope that you can understand, and that is not a problem for you. So what's happening tonight? Dermatologist Jakob Nielsen is going to tell us about the 20-week study we did with Acceleroot. We have Ole Martin here, who has been using Acceleroot for now a year and a half. So he will be telling you about his experience with the product. And also afterward, we do take questions and we will be answering live for you. So again, we're so happy to see you here. And let's get started. And I will start with telling you how Acceleroot came about. So I have always believed that answers is to be found in nature. And when I put together this formula, I wanted it to be 100% natural. I didn't want any fillers or harsh alcohol or other chemicals in it. I wanted it 100% natural. And what was important was, a lot of us know that there are certain vitamins that is important for good hair health, but I wanted all the vitamins that the plants could give, and all the minerals and all the phytosterols. So that's what I did. I searched and found the oils that had all the different vitamins in them. And also I knew from previous that there had been studies done on certain oils that had shown that they could possibly block DHT, and also some oils that could increase local blood circulation to the scalp. So that was also very important. And last but not least, I needed to find some carrier oils that in study had shown that they could actually penetrate deep enough to be able to reach the hair cortex. So that's what I did. And when the first test people started coming back after only 4 to 6 weeks with beginning results, and also after 12 to 20 weeks, I had amazing results. We knew that we had something really special. So I was given 3 minutes to do this, and I do like to talk a lot about this. This is my baby. And but I shall stop here, and I want to introduce Jakob Nielsen, and he will take you through what we found with the study. So Jakob, you can go ahead now.
All right, great. Well, thank you, Jill. So yes, I'm Jakob. I'm a dermatologist, and I joined the Novivo team here. How long is it now? More than a year ago now. When they were in the process of running this trial that we'll be talking about. My background is I worked in the clinical field with patients in the hospital and a private practice setting, and I've also been in the pharma industry with medical drug development within dermatology. So I was appealed by this idea to have a natural product that could treat a very common condition that pharma is actually oftentimes not focusing on because they don't feel it's a big medical need, although this is a problem for many people. So anyway, so I was very excited to join, and now I'll take you through the clinical trial. And I'm going to just see here to share the screen. There we go. Let me just... Are you seeing the screen now?
Yes.
Great. Okay, so the clinical trial here we call it the Acceleroot clinical study. And just before we begin, I just have a few disclosure here. So I'm working for Novivo, of course, but I don't have any ownership stake in the company, and that's important for me to stay, independent from the study and to give my advice without that influence. Also, I think it's important to just mention here that my position here is from a medical perspective, and some of the terminology I'll be using is sort of within that space. But when we are dealing with a cosmetic, there are regulations, what you can say and so forth, and this is a scientific presentation, so I may be using terms that within that space is not quite the right, but bear with me on that. And there we go. So first of all, I just want to talk briefly about the type of baldness that we are dealing with here, and we call it either androgenic alopecia or male pattern and female pattern baldness, and this is a really common condition. This is the Norwood-Hamilton sort of scale that has been created in the 50s to sort of show the progression from young men and up to older, or both with age but also with severity. This progresses. And as you can see here, by the age 30, 30% have stage 2. And by the age 50, about 50% has this stage. And then they tend to progress with time. So somewhere between 50 to 70% progress to the very severe stages when they reach in the 70s. Similarly, there is a scale for female. That's called the Ludwig stages, and for female, this condition is a lot more uncommon. So maybe 3 to 6% have this condition when they are in their 30s, and it reaches maybe around 30 to 40% by the age 50. But it's important to note that this really does affect both genders, and that it's something that has a significant impact on the psychological well-being. And I think all people working with this condition have met young men who are really frustrated that they lose their hair at a young age. Let me see here. So just briefly about the mechanism. I'll focus mainly on what happens in men. There are some distinctions here, but first of all, most people realize that there's a strong heritability. So if your father has this condition, you are likely to have it also if you are a son born. And this has something to do with the androgens in the body, and the 5-alpha reductase that converts testosterone to the DTH, which is really the hormone that affects the hair follicles. So there are different mechanisms involved, but the DTH conversion here is really important and has been the target of many of the treatments that are out there. The effect of the DTH is to alter the hair cycle. So the anagen phase, which is the phase where the hair grows, becomes shorter, and the time spent in the resting phase becomes longer. So the hair doesn't grow as much. And the other thing that happens is that the hair simply gets smaller. The hair follicle that creates the hair gets smaller and then produces a smaller hair. And that, for every cycle that the hair grows, this becomes more and more pronounced. So over time, with each hair cycle, the hair simply becomes smaller and smaller until there's really no hair visible. And that's also this change in hair diameter is what we look for early stages to show if the variability in hair width increases. That's a sign that this disease is progressing or starting to show. So in the study we did, which is a 20-week open label trial, and I'll go back and say a little bit more what that is. We had a timeline starting here at baseline, and we followed the participants for 20 weeks. We had male people and male participants, and we had female participants. The numbers here are 70% male and 30% female were the ones that completed the study. When they started, they had mild to moderate hair loss, and of the 34 that started, 30 completed the study. So we had a few that stopped during the course of the study. When we say it's open label, it means that all the participants knew what they were getting. So some of you may have heard about what we call randomized control trials. This is what we do in drug development, where it's randomized, so they don't know if they're treated, and it's blinded, and they don't know if they're getting the actual drug or not. In this study, all the participants got the treatment for the full duration of the study. And the treatment they did was to apply 1 milliliter of the Acceleroot hair oil every other day, and they massaged it into the scalp and let it sit there for at least 3 hours. Let's see here, change the screen. So the assessments that we did, we were focused on trying to get different perspectives on hair growth and to sort of support, and that could support each other. So one way that we simply took a digital camera with a magnifying lens on, what's called the hair metrics, and you can take a picture of the scalp and it automatically can count the number of hairs within a given area. So you get a measure of the number of hairs per square centimeter, what we call the hair density. The other way we looked at it was simply to have a trained evaluator or investigator look at the hair and say, how full does it look? And then grade it from 0 to 5, 5 being a very full hair and 0 being completely bald. To have more what we call a global assessment, looking from a distance of as you see in the picture, and evaluating, does it look dense? Does the hair growth look dense, and how does the hair straws look, and does it look healthy? We also, of course, asked the participants, how do you feel about this? And we had a long questionnaire where they answered at each visit. And then we followed and tracked those changes over time. And some of these were, of course, related again to the hair density and how does the hair feel and so forth. We'll come back to that. And lastly, of course, when you do studies like this, it's really important to also find out if the treatment is safe. So the patient or the participants answered at every visit if they'd had any side effects to the treatment or if anything unusual had happened. So the main results that we get, I'm not presenting all of them, I'm taking the most important ones. Here we see the hair metrics numbers. And on the axis out on the side, on the y-axis, you can see the total hair count per square centimeters. And on the horizontal axis, you see the time. And you can see we start out with a hair density around between 170 and 180, but you see the arrow bars, it means that they didn't all have the same hair count, of course. There was some variance between the different participants. And then we simply measured in the same location on the scalp from time to time, from visit to visit, and we saw how the counts change. And as you can see, there was actually what appeared to be a little dip at week 4, and then it increased once we got to week 12 and week 20. Let me see here, there should be a little animation there. So that out at week 12 and week 20, we have an increase in about 17 to 18 hairs per square centimeter. While at the beginning here, we had a little drop. Now, of course, this little drop here in the beginning seems alarming, but we actually know from other studies that it is a normal thing to see. If you do something to the hair that makes it grow, the first thing that will happen is that these resting hairs get pushed out, and then the hair follicle looks empty, and when you then count it, it looks like there is no hair. So it's from other treatments that have been shown to work, this is a normal thing to observe. It doesn't happen in everybody, but that you have a little bit of hair shedding within the first weeks of treatment is actually something that is well described. And then hair grows slow, so it does take a little while before you see it, before it comes out of the hair follicle above the scalp level. And so at week 12, we see a clear increase, and then there was some variance that made it not really appear to increase further, but a little bit between week 12 and week 20. So that was the main count on hairs per square centimeters. We had a curve where we looked also at the width of the hair and took the sum of that as a measure of how much of the scalp was covered with hair, and that curve looked pretty much the same, so indicating that more hair was there and less of the scalp was therefore visible. Oh, sorry, that goes fast. There we go. Then the other, if you remember, the second way to look at it was to have the investigator evaluate the hair. And as you see here at the bottom, we had a column showing hair density, one for hair strand thickness, and one for hair health. And on the y-axis, you have the percentage of people who responded to the treatment. And we defined a responder as a person that showed an increase in the hair score from 0 to 5, as you see out here on the side. If they increased one full number, so meaning going from 2 to 3, then they were a responder. They could also be from 2 to 4, but they just had to respond 1 or more, then we counted as a responder. And as you can see, if we just focus on the hair density at week 4, that happened for 13%, corresponding with that this time is a little bit too early to really see the effects. But once we reach week 12, we had 67% having an improvement of 1 point or more. And at week 20, the number was 90%. And when you then look at the other things to look at, thickness and hair health, they also increase in the same way. The hair health seemed to jump up more quickly, whereas the thickness sort of followed the density. And this hair health is sort of how does the hair straw and also the existing hair straw look. So the hair that is already there also looks just more healthy already at 4 weeks. The last one was the participant questionnaire. And this was a long questionnaire. I've just taken the 3 important ones here. And the one was that did the hair oil application seem to reduce the hair shedding? And as you can see, already at 4 weeks, 60% or now 59% thought that it decreased, and that increased then to 77 and 80% at week 12 and at week 20. When we then look at the question of natural hair growth is visibly increased, we had 50% agreeing already at week 4 and 70 and 77 at week 12 and 20. And similarly for the last one, a very important question, does your hair look denser? And here we see at week 20, 70% agreed. And the important thing here, when you look across the different ways to assess this, we ask with the camera, we ask the investigator, and we ask the patient. The numbers are in the same range. We have, somewhere between 60 to 80% thinking they have more hair, whether we ask them directly, the investigator, or take an image and analyze that. So that's very compelling that they all sort of say the same. So this one is just to remind you that there are common treatments out there. These are medical treatments, and Acceleroot is a cosmetic. Just to make completely clear here, we're not trying to compare up against a medical treatment, suggesting that we're not suggesting this is a medical treatment, but just so you're aware that the most common one that many people know is finasteride and dutasteride. So these are inhibitors of this 5-alpha reductase, and they have been proven to increase hair growth, but they can only be used in men because there are hormonal side effects. Most people are also familiar with topical minoxidil that promotes growth and some vasodilation around the hair follicle. There are some other androgen receptor blockades, oral spironolactone. This is typically just used in women because there can be some hormonal side effects in men. And then there are some other treatments that are less established, but still show some promise with low-level laser light therapy, PRP injections, and of course, hair transplants, which is a surgical procedure and quite invasive. So this is just to give you a quick overview of what else is out there. And then back to Acceleroot and why we think it works. As Jill already pointed out, there's a long list of ingredients, and the idea here is that there's evidence in some form, some from clinical studies, some from cellular studies, from different sort of areas of the research that suggest it has a beneficial effect. And that's also sort of the sum of this that we believe is the reason Acceleroot works. So the pumpkin seed, the rosemary oil, they seem to there's evidence that they affect the DTH modulation, so the conversion, so the 5-alpha reductase, and it may affect circulation around the hair follicles. The peppermint may affect microcirculation, and then some of the other ones are affecting the antioxidants, or they may affect inflammation, or they may simply improve the environment by hydrating the dermis. Let me see. And then the take-home message here from this study is that we see a gradual effect on hair growth, and it's clearly visible at week 12. it improves the scalp comfort and hair appearance, so it looks more healthy and denser. Importantly, in this study, we had no reported side effects, and the sum of this is that we believe Acceleroot is really a product that is evidence-based, and that it is a good option and a completely natural option for improving hair growth for people with this condition. So I think that was the end of my talk here. Let me just end the sharing. Or if, I don't know, are there any questions? We need to go back to some of the slides, or?
I think we'll just do the questions afterward. I think we'll just say thank you for now to you,
Yes.
Jacob, and then we can go on to the questions a little bit later. So now we move on to Ole Martin.
Yes.
So you have been using Acceleroot now for 1.5 years. How did you start? What was your journey there?
I started, I don't know how much to say, but I can say started noticing that I had a slowly receding hairline in my early 20s, and it was kind of depressing and took a lot of my time looking in the mirror and checking for if it had gotten worse. So when I came over Acceleroot, I wanted to try it. At this point, I had tried a lot of shampoos and other products with no effect. But I thought, we could try this one too. So, I started in April 18 months ago, and kind of quickly, after 6 to 8 weeks, noticed that I could see hair that hadn't been there in a while.
So that is really amazing. So you were one of the ones that actually responded fairly early. So obviously, so I can tell everyone here that Ole Martin, he was one of 7 men that we actually followed for 6 months and filmed once a month to follow the progress. So when you started this, did you believe that this would have an effect? What was your thoughts around that?
Initially, I was quite skeptical because I hadn't heard of it before, but then I understood it was a new product. So, and at this point, I was probably, I wouldn't say desperate, but it was something that had been bugging my mind through my 20s, and thought, what do I have to lose to try it? And also getting out of the comfort zone, sitting in front of the camera. So
at least not that. Yes. So basically, you have, so last time I spoke to you, which is a couple of months ago, you told me that what you are noticing is that your hair loss, you're not losing hair like you did. So it seems to have kind of stopped excessive hair loss.
And I would say that that's probably the main effect. Before I started Acceleroot, and I shaved my head to this length before we started filming, and I didn't quite realize how it looked until I started taking pictures of it. I have an interest in film and have good equipment, so I have documented it pretty well myself from time to time. The stop of hair loss is kind of like the main thing. And I have also seen that the hair has become thicker, and have the small bald spot right back here, which now has hair on it. So
yeah, no, that is really amazing. I can actually see it because I haven't seen you for a while. So when I came in today, I could see this actually thicker than what I saw last time. But it's still not a full head of hair. So my question is then, is this meaningful for you? Is this something that you would want to continue with the results that you have gotten now?
Yeah. As well as the hair has gotten thicker and stopped my hair loss. It's no, I don't see any reason to stop using it. And the hair quality also is a lot better. So as stopping the hair loss, I mean, how can I put this? My hairline is the way it is, and at some point I had hair a bit lower than I do now, and in an ideal world I would get it all back, but I'm amazed at the results anyway. And if I don't get to have my dream hair, people who are early in the phase of losing hair would, in my opinion, and from what I've seen for my own results, they would have a good benefit of Acceleroot. So, yeah.
That's very good. I'm just going to see if there's anything else I would want to ask you. I just want to say one more thing. You see it yourself. Has anyone commented? Does other people see it? I started telling people that we were shooting the commercial video and me using the product. People close to me that knew that I was a part of this. They were studying your head then, basically.
Yeah, and we're looking like you have gotten thicker hair. And also from the pictures I've taken, I strategically put the pictures side by side without writing which one is which, so people can do their own judgment. And I had a friend, we put it on the TV because it's easier to see on a big screen. And he was like, wow, it's clearly had a good effect.
That is amazing. Yeah, it's amazing. It's an amazing product. I think that we can go. We have had a few questions, so we can maybe do a few of them. Also, we do have questions every day of people that's wondering different things, and we do have a question and answer page on Acceleroot.no and Acceleroot.com. You can also go and read some more there. But one of the questions I get a lot is, do I have to keep using it after I get results, or can I stop? And if you have a male pattern baldness or female pattern baldness, the answer is yes, you have to keep using it. We have, and I suppose that has to do with the DHT hormone. So if you think about it, if you take vitamin tablets or even the food you eat every day, you don't take that for 4 weeks and then stop and think it's going to last. So you have to continue basically putting it, giving your scalp those vitamins and the DHT blockers to be able to maintain it. Now, one of our hero test people out of it, maybe all of you have seen him on our webpage. He's 72 and has had the typical bald male pattern bald spot in his crown for over 20 years. So he used Acceleroot for 4 months and got really good results. And then he went on an extended holiday and left his oil behind. So when he came back, he had lost it. So that just shows that it's very important to keep using it. The good thing is, though, when he started using it again, it took him 20 weeks and he had the same results. So it shows that it's not all is not lost. If you stop it and lose your hair, you can start again. When it comes to other kind of hair loss, like maybe periodic hair loss after pregnancy or breastfeeding, or maybe after stress, there might be that you can use Acceleroot for those periods that you don't need to do it all the time. But in the study that we did, it was the male pattern and female pattern baldness that we studied. So they would have to use it all the time. Another question. Let's have a look. Yes, of course. Does Acceleroot work both for men and women? And again, in the study, we did 70% of men were men and 30% were women, and we didn't see any difference in the sexes, whether of who had results and who didn't. So yes, it's for both men and women. How does the oil smell? Now, obviously, if you're going to put this on 3 times a week, you don't want it to smell foul. And I can ask you, how does it smell?
Not bad at all. Yeah, it smells like a natural product. I don't know how else to put it, but yeah.
I would say it probably has got a mixed smell of peppermint and rosemary oil. So it's, well, those that like peppermint and rosemary, it's a pleasant smell. And I think that was actually one of the questions that we asked in the study as well. And I think probably about 90% said that they like the smell. And then you always have the ones that didn't. But yes. And there was one more question I wanted to ask you. The fact that it's 100% natural product, was that important to you?
Yes, 100%. In the recent years, I've been more and more aware of both the food I eat, but also the things I put on my body. So, yeah, the fact that it's 100% natural, I think, for me, is a really big thing. Yeah, the best medicine and food is from nature. So, yeah.
Yeah, then we agree.
Yeah.
Yes.
Something here. About the smell, actually, in the study. Can you hear me?
Yeah.
Yes.
Yeah. So I just actually, the interesting part is also sometimes with these products you grow tired of things, right? Here, when it comes to the smell, which I mean, I think it has that pleasant, fresh kind of smell, but people kept scoring it high. They liked it from the beginning to the end. Sometimes if you grow tired of it, you'd expect the evaluation to decrease over time, but it actually stayed up there right around 90% from week 4, 12, and 20. So that that's a good sign that you keep being happy about using it.
Yes.
That's a really important thing, to keep using it, which is required to keep the effect.
Yeah, and I think I think you can class it as a unisex smell. It's not like a typical female smell or a male smell. It's for everybody.
Yeah, it's just a fresh, I don't know, flowery, fruity, citric, a little citrus, very pleasant. So.
All right. So I can talk a little bit about basically we sell the packet in a 4-month supply, and the reason why we've done this is exactly what Jacob has been saying about the study. That the study went over 20 weeks. Yes, we saw a few people with responding results after 4 weeks, but the majority of the responders had an effect after 12 to 20 weeks. So we didn't want people to buy a month's supply and then maybe end up where we saw the little dip after 4 weeks and then say this is not working. In fact, if you see the little dip, it can actually indicate that it's definitely working, because like Jacob says, it's pushing out the hairs that's already on its way out to make way for new growth from the hair sacs. So that's why we decided to do the 4-month supply, to give everyone enough time to see if this product is actually going to be effective for them. Then at the same time, I can actually then tell you about 120-day money-back guarantee, because there is a few people that think that our product is expensive. And yes, it's a lot of money to pay out if you don't know if something is going to work for you. And that is why we have put in this guarantee. So if you follow that, you put it on 3 times a week, and you use it for 120 days and you do not have any effect, then you send these pictures, because you have to take and document with pictures before you start and through the process, and you send the pictures to us and we go through them, and we are very reasonable. If you have followed the process and what you're supposed to do, and you do not have a meaningful result, we do not normally argue about our guarantee. So I just wanted to let you know about that. So if you want to try it, but you find it a bit pricey, just in case it's not working, if it's working for you, it's definitely, it's so worth it. And if it's not working, then call us and we'll sort it out. So I think let's just have a look here. So basically, do you have any questions to Jacob?
Yeah, one question actually. I was thinking, what kind of lifestyle choices or dietary choices affect hair growth both negatively and positively?
Well, that's a difficult one. Looking from sort of a scientific perspective, that's actually hard to answer. But I think, as for everything else with the body, if you eat a healthy diet, a varied diet, and make sure you have a lot of sufficient of the daily vitamins and minerals that you need, I think that's really important in terms of food. In terms of lifestyle, otherwise, a healthy lifestyle, I think, is good. Whether the effect comes through reduced stress, I think many people experience that stressful periods affect the entire body, including hair growth. It's not uncommon to hear people say that their hair loss condition started as a consequence to stressful periods in their lives. So to ensure that you live a peaceful and happy life, I think is important, and that comes together with, in general, just taking care of yourself. So this, I'm not able to point to specific dietary things that you should eat to improve, other than, a generally good, healthy diet. Oftentimes, though, we do say maybe, some of the Q10 or biotin kind of supplements, but the evidence here is not super great. So in general, just healthy, normal diet is, and a healthy lifestyle in terms of stressors and exercise and sleep and all these other good things, I think the main answer I can give you here.
And keep hydrated.
And hydrate, yeah, that's part of it.
Yes, I think that's also important.
Actually, I mean, that's maybe not so much for male people, but for female with different hairstyles, if you have a very tight hairstyle with a ponytail that pulls on, you can have traction on the hair that can cause it to cause receding hairlines. And also, of course, very extensive hair care procedures or hair coloration, other things that can give inflammation in the scalp or mechanically pull the hair is, of course, not helpful for hair growth.
Yeah.
Anything else?
No.
Do you have any questions to us, Jacob?
To you, or
to Ole Martin, possibly?
Yeah, I know. I was just wondering, thinking there when you described when it started. I mean, I think you are the classic sort of person with this condition. In the 20s, you start to see this hairline, and it starts to bother you, right? And you want to do something. So in that sense, you are very much the stereotypical person who wants to do something, and so for that, I think you are a good representative also of one way it can work out, that you can, in your case, maybe stabilize. That's your main observation, but also slowly see some growth, and it simply may take some time to see the effects. So I think that was when you presented initially how the start had been. I think many people can relate to that. That it's a really frustrating thing to see happening in the 20s. You wanna worry about other things than the hairline. So finding natural products that can maybe counter that, and also where people can get started early on before they feel it's a real problem, but without having to take an actual medication and go to the doctor and maybe have blood test or whatever. This is just something you can start, and hopefully you will see a benefit. So in that sense, I think you're a good representative of somebody. I wish you had the opportunity, when you were in your 20s.
Yeah, 100%. Yeah, so I think stress was probably the trigger for me too. With a stressful job, and what I would say is that I recommend people starting early rather than later, and actually sticking to it. I think most people want quick results, and it's like taking a workout. If you don't see the results within 2 weeks, you stop working out. But I think if people stick to using Acceleroot for the 3-month period, I think at the minimum it will stop their hair loss.
Yeah, and as the study showed, it's also healthier looking hair. So everyone wants healthier looking hair anyway, even if they haven't started losing their hair.
Yeah, but and maybe actually just a note to also to add to that. Yes, I mean, of course, with most of these type of conditions, starting early, while the condition has developed, this early stage is always what we recommend. But from the study we had, when we looked at when they entered the study, we scored them whether they were stage 2 or 3 or 4, or how they scored on that overall assessment. And when we looked at the different subgroups, we actually did see the same degree of effect also in the more severe. So it's not, it shouldn't be discouragement that you start later, but as with anything else, you want to treat things early. But just to actually make that clear, that we saw the same degree of effect in the people who entered the study with a more severe hair loss than the milder types.
Yeah.
Yes, so then I suppose we can stop this sending, but please, if there is any more questions you want answers to, you can always contact us on info@acceleroot.no, or you can go into acceleroot.no or acceleroot.com to read everything about it, about the product, basically about us, about the study, and about our test people that is outside the study as well. And just always feel free to send a mail and ask. We are available to answer your questions. So then I just want to thank you very much for joining us tonight. Thank you, Jacob, for joining us and showing us how our amazing study looks like.
Thank you.
We are very proud of Acceleroot, and we hope that more people will get to know it